you feel tightness in your chest, a burning sensation rising up toward your throat. And you wonder, is this a heart attack or just a little heartburn? So you wait, just a bit, then a little more, because you don't want to worry anyone, especially if it's just digestion. I'm Dr. Kela, and I'm here today to help you answer that important question as early as possible, because a heart attack and acid reflux are two very different conditions, but they can feel very similar, especially in people over 60. And if you confuse the two, you might miss the best time to save your heart. I've seen many patients who waited too long, thinking it was just gas or indigestion. They took medicine at home, but when they finally came to the hospital, the heart damage was already serious. On the other hand, I've also seen people get very worried over a mild chest pain, and that anxiety caused more stress than necessary. So, in this video, I'll walk you through each symptom in a clear way. We'll look at the key differences between the two conditions, and I'll share simple, practical tips to help you know when it's time to take action and when it's okay to feel more at ease. This is simple knowledge, but it's powerful. It might help you or someone you love spot the signs early and protect the heart just in time. Why are heart attacks and acid reflux so easy to confuse? In real life, one big reason older adults hesitate to call for help is they're just not sure. They wonder, is this chest pain from my heart or just my stomach? The main reason these two conditions are so easy to mix up is because they both cause discomfort in the same area, right behind the breastbone in the center of the chest. It might feel like pressure, tightness, burning, or just something's not right. Both can happen after eating. Both can cause that rising feeling into your throat. Sometimes both can bring nausea, sweating, or vague anxiety. And these unclear signals only say yes cause seniors to ignore real danger or worry too much over something minor. Here's something else to keep in mind. Sometimes an antacid, a stomach medicine, can make heart attack pain feel a little better for a short while. That might trick you into thinking you treated the problem, but in reality, the damage to your heart could still be silently getting worse. I remember a 68-year-old man who came in after over 6 hours of dull chest pain. He thought it was just from spicy food. He took some antacid, felt a little better, so he waited. When he arrived, tests showed signs of a heart attack, specifically a type that often mimics reflux symptoms. On the flip side, I've seen folks with regular heartburn after eating, just bloating and sour burps, get terrified they were having a heart attack. While it wasn't dangerous, that kind of ongoing anxiety can hurt your emotional and heart health over time. So here's the bottom line. Heart attacks and acid reflux are completely gone at different problems, but the symptoms can look so similar, they confuse even people with experience. That's why it's so important to learn the small differences that can make a big impact. To tell the difference clearly, we first need to understand what a heart attack really is. A heart attack happens when part of your heart muscle doesn't get enough blood. This usually happens because one or more heart arteries get narrowed or blocked. Without quick treatment, that part of the heart can start to die. This is called a heart attack, and it can be fatal. So what does a heart attack feel like? The most common symptom is a feeling of pressure or pain in the center of your chest, right behind the breastbone. The pain usually lasts more than 10 to 15 minutes, and doesn't go away with rest. Feels like something is pressing, squeezing, or crushing your chest. May spread to your left shoulder, arm, upper back, or lower jaw. Comes with shortness of breath, cold sweats, dizziness, or a strange sense of anxiety or dread. But here's the tricky part. Not everyone has the textbook symptoms. Older adults, especially women or people with diabetes or other chronic, often have what we call silent or unusual heart attacks. In those cases, the symptoms may feel like just a mild pressure in the chest or upper back, sudden fatigue, shortness of breath, or feeling completely drained, nausea or stomach discomfort, almost like indigestion, cold sweats, even when you're not hot or active. The real danger is that these milder symptoms are often mistaken for reflux, the flu, or just being tired. So people wait and don't get help in time. I once cared for a woman in her 70s who felt just a little chest heaviness and mild nausea after dinner. She thought it was reflux from lying down too soon. 2 hours later, her family brought her to the ER, and she was having a heart attack. That's why we must remember, a heart attack doesn't always feel dramatic. It can come quietly. And the key is knowing your body and noticing when something feels different. Now that we understand what a heart attack looks like, let's take a closer look at one of the most common conditions that mimics it, acid reflux, also called GERD. This happens when acid from your stomach moves back up into the tube that carries food from your mouth to your stomach, the esophagus. That acid can burn and irritate the lining, causing chest pain or a burning feeling, sometimes rising into the throat. Because your esophagus sits right behind the chest bone, reflux can feel a lot like a heart attack. So how do we tell the difference? Here are some typical signs of acid reflux. A burning feeling in the center of the chest or just above the belly button. Often happens after meals, especially large or spicy ones. Gets worse when you lie down or bend over. Gets better if you stand up, walk around, or take antacid medicine. May come with sour burps or a sour taste in your throat. Usually goes away quickly with stomach meds. Now here's what makes it different from a heart attack. Reflux pain doesn't spread to the arms, back, or jaw. It doesn't come with cold sweats, shortness of breath, or pounding heart. And it usually responds to antacid treatment. But I want to be honest with you. There are cases where chronic reflux becomes severe and can cause strong chest pain that spreads to the back or shoulders. That pain can be scary and feel very much like a heart problem. I once met a 66-year-old woman who had chest pressure every night after dinner. She had to sit up in bed to feel better. We did an upper GI scope and found that she had inflammation in her esophagus caused by long-term acid reflux. The good news is, after just a few weeks of the right treatment, her symptoms got much better. So even though reflux is not life-threatening like a heart attack, if it's not diagnosed and treated correctly, it can really hurt your quality of life, your sleep, your mood, and your peace of mind, especially for older adults. When you feel pain or a burning feeling in your chest, of course, not every symptom is always clear. But if you feel strong chest pain that lasts, and it comes with shortness of breath, sweating, or pain that spreads to your arm, jaw, or back, especially if you have heart problems, high cholesterol, or high blood pressure. Please don't wait. I always tell my patients, if you're not sure, assume it's the heart. Because you can watch reflux, but the heart can't wait. Even if the emergency call turns out to be a false alarm, that's okay. It's much better than being too late. Please don't wait and see when it comes to your heart. If you ever feel chest pain lasting more than 15 minutes, pressure in the center of your chest that spreads to your arm, back, or jaw, trouble breathing, nausea, cold sweats, dizziness, or a deep sense of fear or exhaustion for no clear reason, then this is not the time to drive yourself, not the time to guess, or take random medicine. Call 911 right away or your local emergency number. Tell them you think it might be a heart attack. That way, you'll get the right care, fast. I once saw a man in his 60s. He thought it was just indigestion. He took antacids, laid down, and waited. By the time his family found him, he was struggling to breathe, his lips turning blue. Even though he was rushed to the ER, his heart had already suffered serious damage. Just 30 minutes earlier could have made all the difference. Please don't let hesitation steal the golden time your heart needs. If it turns out to be reflux, your doctor can calm your fears. But if it's the heart and you wait too long, the cost could be too high. And finally, I don't expect you to become a doctor, but I do hope you become someone who listens to your body, who knows when to wait and when to act without delay. If this video helped you, please share it with someone you love, because recognizing the signs just 1 minute sooner today could be what keeps a heart beating tomorrow. Thank you so much for watching to the end. I'm Dr. Kela, and I'll see you in the next video.